The Pharmacy and Therapeutics Committee is a group of persons which formulate policies regarding the therapeutic use of drugs. This committee is composed of various physicians, pharmacists, and other healthcare professionals with the inclusion of the medical staff, and it has a real role to play, and it is one of the important committees in hospital. And coming to the introduction, in these days, even though big to medium to big hospitals exist with a lot of facilities, and there is no up-to-date information, even though they up-to-date information on the drugs and the disease knowledge, and it has to be shared, and always there should be a change or there should be an updation according to the research that is already done, and based on that, diagnostic strategies and way of treating the patients will change, and always this committee will work towards the benefit of the patient. So, considering the complexities surrounding the effective use, it means the drug's effective use, it is necessary for the hospital to establish a system to bring the best medicinal agents to the attention of the medical staff and help them in proper selection of the therapeutic substances. If any therapeutic substance is showing any toxic effects, frequently causing any discomforts are any incompatibilities, physical or chemical incompatibilities of those drugs should be identified and should be either modified or should be replaced with some other drugs which will show a better therapeutic action than the existed drugs. So in that way, the Pharmacy and Therapeutics Committee will help, and it has to be organized and constituted in a hospital. The Pharmacy and Therapeutics Committee is a policy framing and a recommending body to the medical staff and the administration of hospital on matters relating to the therapeutic use of drugs. So, what antibiotics or what therapeutic guidelines should be followed? Any particular disease, so there will be guidelines. If X drug is not working, what is the drug we need to select? And how to modify the treatment pattern by observing the prescription pattern, drug utilization reviews. This committee will look into that and will change the treatment pattern with the consultation of all the healthcare professionals. It also serves as a means of communication between the healthcare professionals and the pharmacy department. And objectives of this pharmacy and therapeutics committee is advisory and educational. Advisory means that the committee assists in the formulation of professional policies regarding drug evaluation, selection, and therapeutic use in hospitals. And another important objective or purpose of this pharmacy and therapeutics committee is educational. By making the changes or by making the best therapeutic outcomes that has to be communicated, and it serves that purpose, that is educational. The committee recommends and assists in various functions designed to meet the needs of the professional staff and physicians, various nurses, pharmacists, and other healthcare personnel for the complete current knowledge of matters pertaining to drugs. And coming to the members of the PTC, there will be at least three physicians from the medical staff. Among three physicians, one will be elected as PTC chairman, and one chief pharmacist will be there. He will be acting as secretary of PTC. A representative from nursing staff, she will act, she will act as joint secretary. A hospital administrator who should be an ex officio member of the committee. Operations of PTC. So at least how many meetings the PT has to PTC meeting should be conducted in the hospital at least 6 times in a year, and also as and when necessary. The committee should invite persons from inside and outside the hospital to its meeting, and the persons who are relevant to the discussions or the problems arising, and who can really contribute towards the benefit of the treatment outcomes and alter the treatment patterns, and also to make the important decisions. They can also be invited, and the PTC members has to identify the right persons for the discussions related to the drug evaluation selection and other toxicokinetic studies related. An agenda should be prepared by a secretary, that is a pharmacist, and should be submitted to the committee members in sufficient copies and in time before the meeting. And he only gathers the people for the meeting and collects the problems that are occurred in the hospital and identify the right people for the discussions. And he is the person to prepare the agenda for the PTC meeting and also minutes of previous meeting and review of contents of hospital formulary. Hospital formulary is a list of drugs that are being used in the hospital and what are the new drugs available or commercially available drugs are there in the market at the present situation that also should be identified by the pharmacist and should be mentioned in PDC meetings. And review of adverse drug reactions, drug interactions, toxic effects, any reported in the hospital. Minutes of meeting should be prepared by the secretary and maintain the permanent records of the hospital. And whenever the inspection happens to the hospital, that should be shown to the particular inspection committee. Recommendations of the committee should be presented to the medical staff once the meeting is over and the decision is being taken. And coming to the functions of the PTC, PTC will serve as an advisory council to the medical staff and hospital administration in all matters related to the use of drugs. And also, it will help it will help in developing and compiling a formulary of drugs and prescriptions accepted for use in various hospitals. The selection of the items to be included in the formulary is based upon its therapeutic use, safety, cost, etc. The committee should minimize the duplication of the same basic drugs or their products. The committee recommends written policies and procedures for selection, procurement, storage, distribution, and use of drugs to establish or plan suitable educational schemes for the hospital professional staff on the matter related to the use of drugs, and also it will help in studying problems related to the distribution and administration of medications in the hospital, and also to make recommendations concerning the drugs to be stocked in wards and emergency, to advise the pharmacy in the implementation of effective drug distribution and control procedures. And policy of this committee is to avoid misunderstanding amongst members and medical staff. These policies were developed. It should be written and circulated to each and every healthcare professional existed in the hospital. Policies should be reviewed periodically to ensure that they are updated with the current knowledge. Proposal of any new drugs to the hospital formulary shall be submitted to the pharmacy department by any medical staff committee. Committee will decide whether to accept or reject. So initially the application through any inquiries or application should be made by any medical staff or a request can be made and that should form reach to the pharmacy so that he can gather all the people for conducting PTC meeting and discuss on the same. And also, drugs evaluated and approved by committee will be assigned to one of the following categories. These are formulary drugs, approved on a conditional trial period, any investigational drugs, if any clinical trials are going on in the hospital. So those drugs which are used in the clinical trials comes under investigational drugs and the specialized formulary drugs. These are the different categories where the drugs will fall under. Drugs which cannot be placed under the above categories are considered as non-formulary drugs and that will be maintained separately. The pre-signing of prescription plans is prohibited. All drugs should be dispensed on the basis of generic names to achieve cost saving. Generic name is nothing but the active ingredient in that particular formulation. Instead of using the brand name, that means a company name, manufacturing company name, use a generic name. So that will be really achieves the cost saving factor. And the PTC have different roles in drug safety, adverse drug reaction, emergency drugs, and also it's in membership and composition. And in drug safety is the major area of responsibility of the hospital. The increased responsibility also includes the moral, legal, and professional obligation of the hospital pharmacists for ensuring safety in handling and administration of drugs. The following are the guidelines issued by committee to ensure the adequate safety in handling and administration of drugs. The pharmacist should be always aware of narcotics and psychotropic drugs, which really causes the habit forming, and sufficient number of qualified staff should be always employed for adequate coverage of the pharmacy. Based on the number of bed size, based on the hospital size, the qualified persons, number of qualified persons will be decided by the administration according to that the recruitment should happen. And always there should be a qualified pharmacist be there in a hospital pharmacy to control over underdrugs. And whether the hospital should provide adequate facilities to make storage and dispensing facilities, that is important. The hospital must have an autonomic stop order regulation for dangerous drugs. If any dangerous events happen to the drugs, those drugs related autonomic regulation should be there, especially these narcotic and psychotropic substances related. Once the drugs are prescribed, so they should not be continued after 48 hours unless the prescription is again recommended by the physician. The poisonous and non-poisonous materials always should be separated. The hospital should permit pharmacists to engage in teaching program to the medical staff so that the current knowledge of the drugs will be known to everyone existed in the hospital. All dozen drug stations should be periodically inspected for the purpose of removing deteriorated and outdated drugs, since the drugs will be distributed to each and every nursing station in case of inpatients. And there should always be an autonomic stop order for the dangerous drugs. The time period is 48 hours unless the physician prescribes one more time or the number of doses, the pharmacist should not fill the prescription. The role of PTC in adverse drug reactions monitoring is to identify the adverse drug reactions and reporting adverse drug reactions to the ADR monitoring centers, and from that it will go to CDSCO, Central Drug Standard Control Organization. And all the adverse drug reactions reported in the hospital should be maintained in a well documented manner. That means with the definition of the adverse drug reaction, what is the adverse drug reaction, with what drug it caused, what are the reasons behind the occurrence of adverse drug reaction, severity and analysis should also be analyzed by the pharmacist with the help of the physician. The attending physician should complete the following information as mentioned in the adverse drug reaction reporting form. So here the details are there clearly. First, the details comes under socio-economic data of the patient habits, smoking habits, alcohol habits, and what drugs he used before the occurrence of this adverse drug reactions, his previous medical history and with the medication history, and what is the suspected drug, what is the brand, and for what purpose the drug is given, and at what dose the drug is prescribed, and route of administration along with the duration should also be mentioned in this form.